Hello everyone, welcome to the Tubes channel. Yesterday we have discussed about intro part of Amoebiasis disease. In that we already discussed the causal organism and the different stages of Entamoeba histolytica, along with the mode of transmission and the incubation period we have already completed. So today we are going to start method of reproduction. Actually, the method of reproduction consists of three main steps. First is excitation. Second, incitation. And third is multiplication. These are the three main steps where the method amoebiasis takes place. Amoebiasis infect the host or a human beings. We'll see now. Actually, this Entamoeba histolytica passes its life cycle only in a human being. Means only one host is required for this for Entamoeba histolytica reproduction. And the cyst with the shape of a quadrinucleate is yesterday I already discussed that cyst having different shapes like a uninucleated, or after some time later it will be a binucleated or quadrinucleated. So when the cyst with a quadrinucleated stage, then only it will be in an infective form, and it will infect the host, infect the host, and inside the body there after the multiplication, the trophozoites and precyst we will see. So the first step in the reproduction is cysts are ingested. Cysts are ingested in a contaminated cysts are ingested from contaminated food or water. Then excitation occurs. Excitation occurs in a small intestine. There it releases a single motile trophozoites that colonize the large bowel. Bowel. After this, these trophozoites migrate, and these trophozoites, when along with the migration, migrates to the large intestine, and migrates to large intestine. And loads and so much of loads in a submucosal tissue of a large intestine. Loads in a submucosal tissue. Means when the person will have this cyst from a contaminated food or water, as I yesterday I discussed in a mode of a transmission, that water or a food that are already contaminated, like if a farmer is they're growing the vegetables with sewage water, that may contain so much of a cyst. So from there, if a person will have this fruit or vegetables directly and they will not clean, the cyst will going to be ingested by the person, and when it will reach to the small intestine, the excitation will occur, and there they release a single motile trophozoites that colonize the large bowel. After the colonizing the large ball, they migrates to large intestine in a large, and they will they will form the heavy colony, and they will be loaded there in a submucosal tissue of large intestine. After this, these trophozoites, there only trophozoites will grow, and multiply by a binary fission. There only they will multiply by a process binary fission, and then it will invade the large intestine. That will cause, at the time when they will invade, it will form the large intestine, large ball or same intestine. While invading the large intestine, they will causing a flask-shaped ulcer. This should be noted, that flask-shaped ulcer will at the time it will be caused when the trophozoites, after multiplication, when it invades the large intestine, at the time it will cause a flask-shaped ulcer, and that person may get a bloody diarrhea. So I said that it consists of three different stages: excitation, incitation, and multiplication. Here a person ingested, and this excitation phase takes place, and then after this trophozoites, when it migrates to large intestine and loads in a submucosal tissue, here it takes place in Encystation, and in the large intestine it multiply, and this step is a multiplication. In this way, the cyst, after ingested in a body, it excite and then incite and then multiply, and then it causes the person to suffer from a flask-shaped ulcer and a bloody diarrhea. Following this, there are 90% of people are asymptomatic, but they can still pass a infection. And following gastrointestinal infection, trophozoites may also invade the bloodstream, and they may also cause a necrotic abscesses, and mostly it will cause particularly it will cause liver. This is a mode of reproduction, or the pathogenesis of Entamoeba histolytica. Now we'll see laboratory diagnosis. Here, the microscopic examination of a stool, they can do the directly microscopic examination of a stool, or obtaining a specimen from extra-intestinal, from liver, lung, or they will do this brain biopsy sample subjected to the routine histopathology selection, or also they can do the histopathology of that section, histopathology section of I said the different histopathology sections of a liver, lung, or a brain biopsy sample. And third, they can do the Giemsa stent, or one of the method is the DNC. They can use to check the liver abscesses when this trophocytes will invade the large intestine. Along with it will infect the bloodstream. Necrotic abscesses, particularly in a liver. So with the help of a DNC they can check. And there are different type of a serological diagnosis. First is the ELISA, then indirect hemagglutinin assay, indirect hemagglutination assay, or gel diffusion. There is so many gel diffusion process. Are there single or double gel diffusion is also there. And the last is the counter current immunoelectrophoresis. So these are the different methods by which they can diagnose this amoebiasis disease with the help of a microscopic examination of a stool, histopathology section of the liver, lungs or brain biopsy portion, and then with the help of a DNC they can check the necrotic abscesses in a liver, ELISA, gel diffusion, counter current immunoelectrophoresis. Now we'll see the clinical spectrum or a sign and the symptoms of the disease. As I said, it's asymptomatic, but it can pass the infections to the it can pass the infectious cyst from host to by the process of a stool. And if one person having amoebiasis, they may get cramps in the stomach, abdominal cramps, and mild diarrhea, to colitis or a dysentery. If the person is severely affected by amoebiasis, the extraintestinal amoebiasis, it will cause amoebic liver cells to it will affect the liver cells, and that may cause liver necrotic abscesses, and this will rarely affect the lungs, skin and genital, but mostly this affect the livers. And at the time of when the livers will affected, after that CNS are affected by this amoebiasis. If a severe amoebiasis disease is if severe amoebiasis disease is there in individual, there may be a liver necrotic abscesses. You can see necrotic abscesses. Now we'll see treatment. Here there are so many different kind of things are there to on the basis of a time duration also. If someone having amoebiasis, frequently there is some medicines are there, like metronidazole or a tinidazole are used to treat the amoebiasis. And if it does not work, patient should get this chloroquine, imatine, and dihydrometine. but this is for a frequent. And now if you will talk about a severe, if some person having a severe embasis, severe amoebiasis, there it's necessary to treat it with a AB. Sometimes surgical drainage may be performed, but this is usually to rule out the another bacterial cause of abscesses, but not this. So mostly frequently this two is given. If it is not work, the chloroquine, imetine and the dihydrometine is given to the patient. Now we'll see the prevention. Prevention is quite easy to understand that what we should do and what we should not do. Like before having a food, we should wash our hand. In that, what I should write, it's a very basic thing that everyone can understand. Before having a food, we should wash your hand. We have to cut our nails every after 2-3 days, so that cysts should not be present there. And avoid passing out stool in a open ground straight. Like PMO have given so many plan for this thing to prevent this outer, like people should not go outside for pass out this stool. They should do all this thing at a home only. And avoiding use of unboiled water. We should not drink water from everywhere. If waters are not available, we should boil that water, and then only we should take, so that we can get the less amount of this parasites. And then improperly washed vegetable we should not take, and anything that can cause, that is from outside, we have to think and we have to wash it properly, and then only we should take. That's for amoebiasis disease. Thank you.